like to introduce Mario Estevez. So Mario is a Hunter syndrome dad and a trainer on racial equity, and he's going to talk about racism, a historical foundation for systemic disparities. So in Mario's work at the Racial Equity Institute, he facilitates trainings that bring awareness and analysis to root causes of racial disparities. He's working to bring a more comprehensive understanding of what institutional and structural racism look like and how to foster more equitable outcomes for rare disease institutions. He's also a board member of Project Alive, and here he worked to add rare diseases to newborn screening panels in Florida and negotiated donated medicines for children with Hunter syndrome in the developing world. Mario earned his Bachelor's of Art degree in History and African American Studies from the University of Central Florida.
Good afternoon. How's everybody doing? Awesome. You know, the last time that I was here at a conference, it was for the National NPS Conference. And at that time, I met with a Japanese biotech that was presenting some really promising data with respect to treatment for the disease that my son has. And after hearing them present and meeting with them, I remember thinking to myself, we might have to move to Japan. And we didn't have to do that. I am happy to say that last year, we did move from the state of Florida to California because my son got into a clinical trial for that very same treatment. He's doing exceedingly well. And so we create, you know, this hotel has some very fond memories given that, and I hope to create some more with you all today. And so, you know, I find myself at the intersection of rare diseases, race, and equity by way of my son's condition, my own racialized experience in this country, and then the work that I do as an organizer and trainer with the Racial Equity Institute. And, you know, as a parent to a child with a rare disease, I work tirelessly to ensure that, you know, my son will not succumb to the disease he's forced to live with. You know, our family has had to make enormous efforts to really make sure that Sebastian sees the best doctors so that proper diagnoses are rendered as quickly as possible. So they're really dealing with the root cause of the thing and not really just the symptoms of it. I think that, you know, the reality of it is that in the same ways that I find myself fighting to make sure that my son does not succumb, sorry, I'm trying to advance my slide, here we go. So in the same ways that I refuse to sit idly by and watch my son succumb to a deadly disease, I also refuse to sit idly by and watch this adopted nation of mine that I also love succumb to the disease of racism and white supremacy. And so these are really critical conversations that need to be had. I'm super grateful for the Rare Disease Diversity Coalition and Global Genes that continue to create these spaces where we're really trying to create real change. But I wonder, when you hear the word racism, or white supremacy for that matter, what comes to mind? Like, where exactly did your mind take you? What most folks tell us is this: that really the root cause of the inequity that we see is indeed hate. So that if we could somehow remove all of the hate-filled people from the equation, it would go a long way to solving our problems. The real issue is that history doesn't bear that out. We're not going to simply love our way out of this thing. And so these conversations, again, are critical, but the question I would like for you to ponder is this: are we having the right conversations? Are we even using the same language when discussing this thing? Here's what I mean. There are a good number of us in this space. If I were to ask you for your definition of racism, how many different definitions do you think we'd have? Probably as many definitions as there are folks in the room. And so this is the first problem that we have to deal with. I'll take it a step further and say that we're not coming into these spaces with the same definitions. We don't have a shared language, and more importantly, a common analysis. And the truth of the matter is that racism is so embedded into the very fabric of this nation that it's truly a part of the genetic makeup of this country. And so if we're serious about bringing an end to this, we need to examine who's responsible for the racially structured society we live in that produces incredibly inequitable and lethal results. But before we get too deep into that discussion, I think it's important for us to really kind of ground ourselves in those gross inequities. I think we're all under the assumption that the majority of us believe that racial inequities are indeed a problem. I was just on a webinar, listening to a webinar with Dr. David Williams, Harvard-trained sociologist, who said that public opinion polls show that about 50% of Americans don't believe that racial inequity is indeed a problem. And so my question for you is this: why is it that so many of us still cannot see the glacial inequities that continue to undermine our religion, our democracy, and our collective humanity? And so I'm just going to run through a couple of slides really quickly so that we can kind of ground ourselves in that data and look at really kind of different sectors of society and how that inequity really shows up. And so what you're seeing here is with the red line, we have our white brothers and sisters represented, with the black line, our African-American brothers and sisters. And we've taken 5 measures, 5 different systems: health, education, criminal justice, protective child services or child protective services, and the economy. And we have a few measures for each of the systems that are listed on the x-axis. The relative rate of index is found along the y-axis. And what this tells us is how many times more likely our African-American brothers and sisters are likely to receive a bad outcome in any of these different systems. And what the data shows is that African-Americans are 2 to 5 times more likely to have negative outcomes across systems in North Carolina. And you're probably saying to yourself, well, Mario, that's the South, right? The same is true in Indiana. I go back to the South, and this is what it looks like in Texas. In the more liberal state of Massachusetts, here in California, and this is what it looks like nationally. Now, I'm sure that most of you noticed that the data we represented is showing racial outcomes for our black and white brothers and sisters. And you're probably thinking to yourself, well, where are other racial groups in this, right? I'm not African American, I may not be white. And so I don't think anybody would disagree that racism is not all about black and white. But I would make the argument to you that it is all about black and white. In this country, we tend to lean very heavily upon dichotomous cognition or dichotomous logic, that everything has to be a yes, no, either or, on or off. I'd like to introduce you to diunidal cognition, which basically says that 2 seemingly opposing ideas can be true at the same time. So yes, racism is not all about black and white. And at the same time, we would argue that it is all about black and white. And you'll see that as we go through this history, how this is all played out. And so how is it that in all of our systems and institutions, we see the same patterns show up over and over again, where collectively, our white brothers and sisters are having the best outcomes, and our black or indigenous brothers and sisters are having the worst outcomes, almost without exception? Now, it certainly depends on how you disaggregate the data and what you're looking for, but this is how it shows up. Now, you have to fall in one of 2 camps. You've either made up your minds about black or brown people due to some inherent deficiency, right? Maybe it's a part of their genetic makeup or a fault of their community, where they end up at the bottom in every city, county, state, across this nation, in all of our systems and institutions, or we need to acknowledge that the gross inequities that we see are caused by something more deeply rooted that cannot be simply explained away by the poor choices of individuals or their respective communities. And so the question for us is, how did we get here? And really, what must we do moving forward if we endeavor to create real change? What we know is that the people who created this country, those that crafted her public policies and her laws, are certainly responsible. What I think is missed is that they were not alone in this. That there were very powerful entities that played an indispensable role in providing to public policymakers the ideological framework that they would use to cement these poisonous ideas into the collective consciousness of the nation. The hard truth that we have to confront is that government officials relied heavily on some very powerful sectors. The religious community, the business community, all played very significant roles in crafting the racially structured society that we find ourselves struggling to combat. I think the other exceedingly powerful sector of society, as you can see there on the screen, that played a key role in all of this is the scientific and medical community. And so we're going to look at just a few examples to kind of help make this larger point that scientific racism is largely responsible for embedding racism and white supremacy into the very fabric of this country. And given that reality, what is the role of the scientific community and medical institutions currently in trying to fix a problem that systems and institutions that they inherited largely constructed? And so, as I said, our founding fathers at the latter part of the 18th century lifted up some incredibly lofty ideals about this nation and what she would ultimately stand for. Maybe none loftier than the words penned by Thomas Jefferson, who boldly proclaimed that all men are created equal, endowed by their Creator with certain unalienable rights, that of these are life, liberty, and the pursuit of happiness. And as we all know, Thomas Jefferson claimed hundreds of human beings as his property. So how could Jefferson make sense of this incredible paradox? What justification would he use to help him with the obvious absurdity surrounding the bold claims, those bold claims in the face of American slavery? Jefferson would turn to scientists, and more specifically, anthropologists. In 1790, Johann Friedrich Blumenbach and George Louis Buffon would provide for our founding fathers the ideological framework that they would need to justify the construction of a supposedly free nation on the very backs of enslaved Africans. With the creation of the Oids, a racial hierarchy is established that would place whites or Caucasians as the models of humanity, therefore the most intelligent and the most human. The counter to all of that would be Negro. What I want to point out is the pattern deviation with respect to Africans. When it comes to all other so-called racial groups, they were given a place on the globe. This means they had geography and some semblance of history, and therefore assigned some level of humanity. With Negro, we would use the Latin word for black. There were other anthropologists who put forth Ethiopoid, Africoid, but in America it's going to land as Negroid. And that was intentional. By stripping our African brothers and sisters of their geography, we robbed them of their humanity and their history. I think it's a really apt description on how white and black really hold the racial arrangement in place in this country. Jefferson was so enamored with Blumenbach that he actually invited him to speak before Congress, also asking to be a part of the American Philosophical Society. And so at this pivotal moment, when we are indeed constructing this nation, it is the scientific community that will give to our founding fathers the right to make such bold claims that were otherwise obviously hypocritical. And so at the turn of the century, African Americans were still struggling to survive the gross inequities wrought by racism. Any attempts made by social reformers to improve the quality of life of African Americans were roundly dismissed. Public policymakers could sit idly by and do nothing because they had it on the best authority that this was indeed the natural order of things. Under the eugenics movement, African Americans, immigrants, our indigenous brothers and sisters, and even poor whites are going to get caught up under this pseudoscience. It will inform immigration policy, ensure the continued oppression of African Americans, and lead to forced sterilization of countless women in the United States. Colleges and universities taught this. Medical societies confirmed it. Clergymen preached it from the pulpit, and it would be funded by Carnegie and Rockefeller. It is under this pseudoscience, or the guise of this pseudoscience, that we'll see the Flexner Report come to fruition. Abraham Flexner will be tasked with standardizing the American medical profession. And the standardization of the American medical profession at this moment was a good thing. It was kind of like a Wild West. But again, leaning upon that diurnal cognition, it also had some disastrous effects. What is also true about Abraham Flexner is that he was misogynistic, bigoted, and racist. And so this landmark report published in 1910 have impacts, again, that we're still feeling to this day. Flexner will close many medical schools across the country that didn't meet the standards that he set. And he will essentially destroy the black medical profession. He will close 5 out of 7 medical schools. The only 2 that will remain open is Howard and Meharry. What he says, too, of African American doctors is this: they should be trained in hygiene rather than surgery, and should primarily serve as sanitarians whose purpose should be to protect whites from communicable diseases like tuberculosis. Now, we know that blacks have graduated from every medical institution in the United States, but that decade of exclusion has resulted in an almost insurmountable manpower and opportunity gap. An extrapolation based on the data from the medical schools that did remain open indicated that if those 5 schools had stayed open, the ones that he closed down, we might have collectively provided training to an additional 35,315 graduates in just 2019 alone. And so when we're not rooted in this history, what we do is find ourselves, asking silly questions about why we have so few black doctors in the profession, and whether or not, we need to encourage black and brown kids to STEM programs, science, technology, engineering, and math, to motivate them right into professions that they were historically excluded from. I want to move on. In 1929, W.B. Du Bois will debate Theodore Studdard on whether or not the Negro should be encouraged to cultural equality. Studdard summarized his conclusions with the following: today, as never before, we possess a clear appreciation of racial realities. We know that our America is a white America, and the overwhelming weight of both historical and scientific evidence shows that only so long as the American people remain white will its institutions, ideals, and culture continue to fit the temperament of its inhabitants, and hence continue to endure. Studdard had excellent reason to celebrate the clarity of his views. Quite literally, he had it on the best authority. His concept of race as the determining factor in human affairs was supported with virtual unanimity by leading scientific figures. Biologists, psychologists, sociologists all proclaimed with one voice the supposed inherent and irrefutable inferiority of the so-called black race. So it's not as if the scientific community sat idly by while public policymakers passed legislation that had detrimental effects on the lives of our black and brown brothers and sisters. Now, again, what they did was play a significant role in constructing this racially structured society that we find ourselves producing incredibly inequitable results. And so tackling systemic inequities, right, what we say at REI, at the Racial Equity Institute, is that diagnosis determines treatment. Something that you all can appreciate in this space probably more than in any other space. How you diagnose a problem will dictate how you go about solving that problem. And with an improper diagnosis, can we actually get at the root cause of the problem? Really quickly want to talk about the Pima Indians, because I think it's a good example of what is typically our approach. They have the highest rates of type 2 diabetes in the world. 50% of all adults suffer from type 2 diabetes, 7 times the national average. And so the medical community believed that the Pima susceptibility to diabetes was possibly an anomaly, that maybe something in their biology or in their genetic makeup made it so that they were suffering type 2 diabetes at, again, incredibly high rates. And so the NIH collected hundreds of thousands of blood samples and tissue samples along with medical histories for the Pima. Dr. Peter Bennett turned to genetics for answers. And although his efforts were well-intended, they were also misguided. I think it's also indicative of what is typically our approach to solving health inequities. Now, I'm not at all trying to suggest that the collection of genomic data for our indigenous brothers and sisters is a bad thing. Right? We actually have a problem that the vast majority of large genomic variation studies are conducted on our white brothers and sisters. Now, that's improving, and it has been in recent years. What I am saying is that when we look at individuals or their communities to figure out how to fix the problem, we're really looking at it on an individual basis. And what ends up happening is that we give our systems and institutions a pass. Why do the Pima have diabetes at 7 to 10 times a greater rate than their white counterparts? Because they were forced off of their land. They lost land rights, water rights, and because they were literally starving to death, had to rely on government subsidies in order to survive. And the food that the federal government was distributing to the Pima was a diabetic nightmare. The social determinants of health. Now you're saying to yourself, well, that's one piece of anecdotal evidence, Mario. What other evidence do you have? And so this is a report put forth by the NIH, 30 years of disparities intervention research. What are we doing to close racial and ethnic gaps in healthcare? Major public health research showed that out of approximately 400 public health interventions to address disparities, I want you to guess, how many do you think were targeted at the systemic level? You can see by the chart, you'd say maybe 1%. It's actually 0.1%. I had to fudge the data so that you could even see the dark blue bar, because you otherwise could not see it. And what is clear is that who we see as the problem, how we have diagnosed the problem, is dictating our solutions to said problem. And our interventions clearly show that we're essentially blaming individuals and their respective communities for the systemic inequities that, again, are killing them. And so how seriously has the modern scientific community been in confronting systemic racism to deal with health inequities? What the data is showing is that they've largely ignored it. Medicine's privileged gatekeepers producing harmful ignorance about racism is the title of this report. 30-year report. It essentially says this: ignorance is neither neutral nor benign, especially when it cloaks evidence of harm. And when ignorance is produced and entrenched by gatekeeper medical institutions, as has been the case with the obfuscation of the last 200 years of knowledge about racism and health, the damage is compounded. So this is what the researchers did. They were from 1990 to 2020. They looked at the 5 leading medical journals. So we're looking at the American Journal of Public Health, the British Medical Journal, the Journal of the American Medical Association, the New England Journal of Medicine, and then the Lancet. And they made distinctions between just viewpoints and actual empirical scientific investigations with significant data points. And what they found was that the vast majority were not evidence-based or any real empirical studies. Their conclusions underscore the damage done by the scientific production of ignorance. The main takeaway that I want you to get from this chart here, all those lines that you see in purple are showing the years from 1990 to 2020. And so in 2020, you see a significant uptick on medical journals producing articles around systemic racism. And this is important, right, because the very same powerful agents that help cement systemic racism in the United States historically now produce ignorance about racism and its impacts on the health of people of color. I want to extend some flowers to the American Journal of Public Health because they're the anomaly in this. 60% of the articles that they produced had a significant data point and were really substantive reports. I think it's also true, I should also point out that the American Journal of Public Health produces a vastly fewer number of medical articles than does JAMA, the British Medical Journal, the New England Journal of Medicine, or the Lancet. And so really the main takeaway here is that the vast majority of articles around systemic or structural racism are lacking in empirical studies. really kind of superficial, if you will. When it comes to JAMA, the British Medical Journal, the Lancet, and the New England Journal of Medicine, the numbers are like 4%, 4%, 6%, and maybe 10%. And these were their main takeaways with respect to the problem. So one, it conveys the message that racism and its impacts on health just aren't important, right? And so you minimize the concerns about these harms among scientists, funding agencies, and the broader public. Secondly, it fosters ignorance, as we've been saying. And it really, then that ignorance gets transmitted to professionals, patients, clients, and the broader public. It also effectively excludes scholarship by those medical professionals and researchers who are studying racism and its impacts on health. Really kind of harming knowledge dissemination. And then the last point, which I think really is the most important point, it undercuts and limits the important kinds of evidence needed by policymakers. Those people who craft our laws, or health agencies and funders and lawyers, and the work that they basically need in order to prevent racism and rectify the harms that have been done. And so I want to revisit a question that I asked you all earlier. Why is it that half of Americans don't believe that racial inequities are real? Well, the answer is in part the scientific community. And so when you take all of this into consideration, it's clear that although the scientific community is no longer overtly or intentionally contributing to the problem, because they've largely ignored it, again, even though they've inherited a system that has a really important role in creating it, they're still not a part of the solution. But that's beginning to change. And so, centering equity in the rare disease space is really significant, but there are some major hurdles. Looking at the data around the inequity for rare diseases when it comes to two key factors, that being diagnosis and treatment, the data is really disturbing. In large part because it doesn't exist. And so if we're not able to mark the disparity, how then can we figure out what the systemic interventions are needed to bridge those gaps? Or whether or not the interventions that we put in place are indeed working. I think the second issue, the other major hurdle that we have, that I kind of opened up with this morning, is a lack of common definitions or language or analysis around these things. Right? So when I think of white supremacy, my mind doesn't go to white supremacists. Instead, I see it here. It's imprinted on the landscape via the toxic air that some of us are forced to breathe, or the incredible loss that some of us are forced to endure when it comes to infant mortality rates, or when confronting the criminal injustice system, or the longer diagnostic odyssey and the lack of representation in clinical trials that is still not marked. And so where's the hope in all of this? There is a changing tide. Bear with me through this slide because I said there's hope, and then I'm going to give you some information that is going to make you feel somewhat hopeless, so just give me a second. So in January 2021, 44 states introduced bills or have taken steps that would restrict the teaching of critical race theory, which nobody is doing in secondary education, or to limit how teachers can discuss racism or sexism according to information put forth by Education Week. 18 states have imposed these bans or restrictions through either legislation or other avenues. The same is true at the university level, in the business sector, and also within government agencies. There is massive pushback, legislative pushback, on diversity, equity, and inclusion work. And you're probably saying to yourself, well, Mario, where's the hope? Well, it's right there. What we're seeing is not just rhetorical pushback again, but legislative pushback. Now, if all we're doing is having conversations to try and deepen our understanding around these things, What is everybody so afraid of? What I believe is this: those that have always been on the wrong side of history recognize that for the first time in this country's history, we are seeing major systems and institutions start to reflect and look inward to try and figure out how to dismantle systemic inequities. This map here shows what I believe are last-ditch attempts by those who kind of recognize that they are losing this fight. This is recognition that the organizing work that is being done to dismantle racism and white supremacy is indeed making serious gains. But we all just saw that that work has only just begun, and really only beginning at the systemic level. I want to share this quick graph with you, this timeline of American history with respect to African Americans. You're looking at from 1619 to 1865, mired in chattel slavery, 61% of this country's history. Another 100 years of Jim Crow segregation, that's 25 years of this nation's history. Only 14% have African Americans really started to receive most citizenship rights. And so we really are in our infancy when it comes to the modern era, and just starting to begin to imagine what it would mean like to live in a racially equitable society. A call for change is coming from those from very, very powerful institutions. The American Medical Association in 2020 initiates speaking out against structural racism. The American Public Health Association has acknowledged that racism as a public health crisis. A year later, the National Institutes of Health announces a major multifaceted initiative to address the impacts of structural racism on biomedical research. And then you have the Center for Disease Control in that same year also saying that racism is a serious public health threat. I'm happy to say that our organization works with 3 of the 4 that were mentioned, and have been for the last 4 years. The rare disease space, I think, finds itself in close proximity to the scientific and medical community by way of our unfortunate circumstances. And so in the same way that we're beginning to see medical journals and some of the most powerful institutions in the scientific community acknowledge the threat of systemic racism and that threat that it poses to public health, the rare disease community is also taking its rightful place at the table of equity and justice. It is also true that the rare disease world, more than any other, understands what it means to be minoritized, to be ignored, to face gross imbalances of power that threaten the lives of those we love. And so we find ourselves, I believe, uniquely positioned to make sure that the disease of racism and white supremacy no longer does further damage to our brothers and sisters of color. But again, something that can only be done through a shared language and analysis. You can have the best intentions in the world. If you're not bringing to the table a race analysis, we're gonna throw out gimmicky solutions to really, really difficult problems. And so when we take a seat at the table of equity and justice, we can, with one voice, make a compelling argument to scientists, researchers, scholars, to be the instruments of the community that I truly believe they aspire to be. And I'll leave you with this. I'm not Jewish, but this is a great quote from the Talmud. Do not be daunted by the enormity of the world's grief. Do justly now, love mercy now, walk humbly now. You are not obligated to complete the work, but neither are you free to abandon it. I really appreciate your time and attention. Again, super grateful to be able to deliver this keynote address, and incredibly grateful to the Rare Health Equity Summit, Global Genes, and RDDC for creating this space. Really looking forward to learning from the collective wisdom of the room. Thank you again for your time and attention.